Welcome to page 48 of Anatomy Coloring Book. This is Dr. Stephen Harkins. The muscles of the bony thorax and posterior abdominal wall. The diaphragm muscle is this muscle located beneath the rib cage. The diaphragm assists in breathing. It is this muscle here. It's hidden by this rib cage here. And so the rib cage has been somewhat resected or cut away to show the fibers, the dome-like fibers of the diaphragm, the muscular diaphragm. It's this large, expansive muscle, and of course it would continue over here as well and runs up underneath here. If it were underneath there, I'm drawing as if it's underneath these ribs. And it's a very, very unique muscle. Here it is in the back, and it extends all the way down into the low back, into the lumbar spine. And here's another look at it with the ribs completely resected. Now imagine the lungs up here, the lungs, from which you breathe. Well, how do lungs get air in them? Well, how they get in their air is this dome-like muscle here called the diaphragm contracts. And when it does, when you push your stomach out and you breathe in through your stomach, this dome, which is shaped like this, pushes downward. And when that happens, so you have the lungs up here. When the dome pushes down or pulls down and your belly comes out, breathing in, the diaphragm flattens out, and what it does is it expands the lungs. Notice how this part of the lung here has flattened out along with the diaphragm. So when the diaphragm contracts and pulls downward, it pulls the lungs downward too, and air is able to get in through the trachea, right? The breathing through the mouth. The air comes in and down, and the air is pulled down through the bronchi and the trachea, pulled down, pulled in, and here's your trachea and here's your mouth. The air comes in here because it's pulled down by the effort of the diaphragm, which has gone from a dome shape to a flattened shape. So when you're looking at the diaphragm in its dome shape, you should be thinking, why is it that way? Well, because when it contracts, it flattens out and expands the lung and pulls the air in. Now, the diaphragm goes from the xiphoid process here. Recall the xiphoid process, which is right here. Here it is. It's attached there. It's attached along all the ribs, the back side of the ribs, all the way around to the just behind underneath here. Underneath here, it's attached to the underside of the ribs and the xiphoid process. So it's attached all the way along here to the ribs. Ribs. Actually, the muscle extends down into the lumbar spine and attaches along all the ribs here and the xiphoid process. So you have to imagine, here you see the attachment to the ribs right here. So it's a large, expansive muscle that completely encircles the thoracic cavity. And so the drawing does its best to describe the shape, but imagine it as a dome like so, that contracts and moves downward. So that is the thoracic diaphragm, a very important muscle. And the diaphragm actually has a hole in it where vessels, blood vessels, can pass through. These holes allow the inferior vena cava, this is the vein that takes blood back to the heart right here, and it passes through this little hole in the diaphragm, also known as a hiatus or a foramen. Notice that the esophagus also right here, this is where when you swallow your food's got to go down, it's got to pass through through the diaphragm in order to get to the stomach. And the diaphragm or the esophagus is right here, and it also passes through a hole or a hiatus called the esophageal hiatus. The esophageal hiatus, that's this hole in the diaphragm. And lastly, the aorta. The aorta carries blood from the heart to the abdomen and below into the legs and the lower part of the body. It also passes through a hiatus. There's the aorta. It's a big, huge artery that passes from the heart, down from the heart, and through the diaphragm to provide blood to the abdomen and to the legs. And it passes through the aortic hiatus or foramen. Foramen just means hole. And so here's another look at it. You see the abdominal or the aorta passing through the aortic hiatus. Here you see the esophagus passing through the esophageal hiatus in the diaphragm. And here you see the inferior vena cava passing through the hiatus in the diaphragm as well. So, inferior vena cava, esophagus, and the aorta. The aorta passing through the esophageal and aortic hiatus, hiates, plural. Now, there are some muscles that we've talked about in other lessons on the posterior wall of the posterior wall of the bony thorax, and actually below the bony thorax, the posterior abdominal wall. And these muscles, one we've talked about is the iliopsoas. We've talked about the psoas muscle here, this big long muscle that comes from the lumbar vertebrae in the spine. Let's correct that. And it comes down here and originates off the vertebrae in the lumbar spine, passes underneath the inguinal ligament here, and attaches to the lesser trochanter of the femur. It's called the psoas muscle, or the iliopsoas. This is the psoas major muscle. And then there's a little strip here, tiny little muscle called the psoas minor as well, that kind of gets in on the action. And it joins, of course, with the iliopsoas muscle, the iliacus muscle as it's known. It does the same, and they conjoin to insert on the lesser trochanter of the femur right there. And this is the iliacus muscle. In yellow is the psoas major muscle. And then in red, the psoas minor muscle. All three insert on the lesser trochanter. Correction, the psoas minor attaches to this little eminence here, the iliopubic eminence, right here on the pubic bone. So the psoas major, so the iliopsoas, also known as the iliacus here, emerging from the iliac fossa, joins with the psoas major to insert on the lesser trochanter of the femur, while the psoas minor emerges from the lumbar vertebrae and stops short and inserts onto the superior pubic ramus. Another muscle is the quadratus lumborum muscle here, which forms the part of the posterior abdominal wall. And it arises from the iliac crest of the ilium here. Here's from the back. And up to the 12th rib and attaches to the 12th rib. And it helps, along with the psoas major, psoas minor, forms the posterior abdominal wall. The diaphragm is not the only muscle in charge of breathing. The intercostal muscles are also in charge of breathing. There are 3 layers of intercostal muscles. There's an outer layer, and they are intercostal. Inter means between, and costal means rib, so it's between the ribs. And on the outside here, we have an outer layer called the external intercostals. And then we have another layer underneath that called the internal intercostals. And then underneath that, we have another layer called the innermost intercostals. The innermost intercostals. And here they are. Here. So we have an innermost layer of intercostal muscles. And we have our internal intercostals here, muscles, and then we have our external intercostal muscles. These muscles assist in breathing by elevating the ribs. So you can see these muscles running perpendicular to the ribs. You can imagine if they contract this way, it will pull this rib upward in a bucket handle type movement. So the ribs are getting pulled up. Not only are the lungs being pulled down, by the dome-shaped diaphragm, but the ribs are being elevated by these intercostal muscles. And certainly the ribs, some of the ribs are in charge of pulling the ribs down too for expiration, for forced expiration. So what they do, the intercostals, is they expand, they move the ribs apart, and they bring the ribs together during breathing. And of course, they attach to the ribs. For example, here, there's an origin and then an insertion of the intercostal muscles. Origin, insertion. Or in the case of expiration, blowing out, it would be origin, insertion, where the rib would be being pulled down during forced expiration. So that's the end of lesson page 48 in Anatomy Coloring Book. This is Dr. Stephen Harkins. Until next time.